you're having difficulty putting your hand behind your head, going in that external rotation position of the shoulder, I'm going to show you 7 tips you can do to try to improve your range of motion. The first thing we're going to do is use a cane. Now you can use a cane, you can use a walking stick, piece of PVC pipe, whichever you have, even broom handles to work. All of that stuff will work for this. And I like to do this kind of in 3 positions. Now here's the trick with this when I have you go through these movements. With these movements using the cane, I want you to, not only am I pushing the hand out and the shoulder out, you're going to feel that stretch, I want you to activate the muscles in the direction that we're going. So for example, I'm going to take this, bring my elbow in by my side, I'm using my other hand, I'm pushing on the piece of PVC pipe or cane that you're using, and I'm pushing my hand outwards. Now I'm also trying to contract the muscles in the back portion of my shoulder to make this movement happen as well. So while I'm stretching, I'm also trying to help the movement occur. And I would do it here and I go back and forth, maybe do that for 10 to 15 repetitions, and then I move my elbow out a little bit here. And the same thing, I'm working on trying to bring my hand back, rotate my shoulder back, and I'm using that cane. So the cane I'm using to push with, and at the same time I'm trying to activate those muscles on the back side of my shoulder. And then we're going to try to go all the way up. If you can get the arm out into about 90 degrees of abduction or shoulder level here, and then I'm going to take the cane and I'm trying to push back, almost like I'm going to try to throw a baseball or a softball overhand. I'm pushing back. I'm contracting those muscles on the back side of my shoulder at the same time I'm pushing the cane. And I kind of go back and forth with this. I don't really use this exercise as a stretch alone. It's more active movement because I don't hold it. Just have the patient go back. You hold it just a few seconds, really contract those muscles back there and come right back down. And that's something I repeat several times a day. Next, you're going to take a dumbbell. You're going to go on top of a table or a stable surface. You can do this in sitting or standing, whichever you feel more comfortable. I'm going to bring my arm in this position, grab a hold here of the dumbbell, and rotate backwards. Just try to pick the dumbbell up off of the table. Now the trick with this is I've got my elbow here at a right angle. It doesn't have to be exact, but something pretty close, and then I rotate back. Maybe initially all that you can do is right here, and that's fine. Make sure you're using a dumbbell that's not so heavy that you can't perform the movement. If you need to start much lighter, that's fine. I'd rather you start lighter and do a more correct movement than to try to go with a heavier dumbbell and the movement just get too sloppy. I have patients perform this for 2 to 3 sets of about 10 to 12 repetitions. This exercise I call band pull apart. It's horizontal shoulder abduction, but I just take a band out in front here. You want to make sure that you have the range of motion such that you can get the hands as far back as possible. I wouldn't want you to do this if you're only able to go right here. So kind of move your hands out or get a lighter band so you can pull this apart. Really focus on squeezing the shoulder blades together. So this is not really so much an elbow movement. I'm trying to keep my elbows straight. I'm squeezing my shoulder blades together, kind of pinching my vertebrae and my spine right in the center in the back, because we want to work on those middle back muscles and lower back muscles in the thoracic spine, because those help for the shoulder blade or the scapula to rotate on the ribs. And that's very important. We're trying to reach overhead, in other words, to try to put our hand behind our head. Now we're going to use an exercise band or tubing here to perform external rotation. So just have my elbow kind of tucked in by my side. I'm just pulling this out. I start with my elbow next to my side here, and then I'm going to work on bringing my elbow out about 45 degrees if I can, depending on how my pain level is or your patient's pain level is. And then I'm going to work on trying to get up, bring the shoulder up to shoulder level and do that same movement, similar to what we've done with that cane, kind of bringing the hand back in this position. I repeat each one of those, maybe one set of 10 to 12 repetitions in each position. If you aren't able to bring your arm up, then I would focus on maybe 3 sets, maybe if it's just down in here, just 3 sets in this position. This movement that we're going to perform is going to be a lower trap and middle trap exercise. Just pull down, so you're just going to take the band, fasten it up at a higher level, and just keep your elbow straight and pull down. What I'm focusing on is squeezing my shoulder blades together each time, really kind of trying to pinch this in the back, because remember, those muscles are responsible for helping us to raise our arm overhead. Now we're going to perform doorway stretches or corner stretches, and so what you're going to do is try to get your hands as high up as you can. Maybe initially you have to start down low, and that's fine to really stretch everything in the front part of the chest, the shoulders, working towards getting your hands a little higher up the door facing, and I'm just leaning in. So I'm just leaning in forwards. I feel that stretch all across the front of my shoulders, and I'm going to hold that for 15 to 30 seconds. I'll come off, and then I'll go back in again, 15 to 30 seconds, and I repeat that for maybe 3 to 5 repetitions. Our last movement that we're going to perform is going to be a tabletop slide, and then I'm going to lean in at the same time. So it's both kind of an active range of motion movement and a little bit of a stretch at the same time. So I've got my elbow out here. I'm trying to go in this position. I'm going to rest it on here. If you need to use a towel or a pillowcase, that's fine. You can put that under there and slide up with it. And I'm kind of reaching forwards. As I reach forwards, I lean forwards at the same time, and I come back. So kind of doing two things at once here. I'm reaching and I'm leaning at the same time. So at the end of this movement, my arm looks like this, right? Kind of get up here a little higher because we want to be able to put our hand behind our head. It's been my experience with patients, if you just try to overly stretch them and stretch, or joint mobile, I'm not saying those things don't work. We do, perform joint mobilizations with my patients all the time, as well as perform a lot of stretching and soft tissue work and manual therapy, and all of that stuff works. But if you have a really stubborn shoulder that you're having trouble getting in this position, a lot of times you can't just stretch it into submission. You've got to do some active things to retrain some muscles, to work on some motor control things, to try to improve that for the long term. Thanks so much for watching. I hope this video helps either you or your patient to be able to reach up, put your hand behind your head in that external rotation movement of the shoulder. Make sure you hit that like and subscribe button, and thanks again.